Hi, my name is Maureen May. I'm a registered nurse at Temple University Hospital, and I'm also a PASNAP president. I come to you today to speak to you about the state of our union and the conditions within the environment that we work. I first want to start with morale. The morale within our hospitals is poor. I've spent the past few weeks speaking with nurses all over Pennsylvania, from Butler, PA, Armstrong, from Scranton to Wilkesboro, and right here in southeastern PA. And we are all fighting the same battle. We're all working to ensure that we are safe in our hospitals and that we can take care of our patients. We are all in different stages of this fight, though, in this battle. But the issues remain the same. We're fighting the same war. So the question is, do we have enough PPE? Do we have proper, safe quarantine procedures when we're exposed to the virus? Are we getting tested when we need to get tested? And do we have the staff that we need when the surge happens in our hospital? And the answer to all those questions is no, we don't. But yet the nurses and allied professionals at PASNAP, we're getting it done. We're doing the impossible with limited support and resources. And we're fighting for our patients and saving lives because that's what we do. At all of our hospitals, we're facing a severe shortage of PPE, rationing of supplies, experiencing dangerous quarantine policy, and lack of testing. But I know our circumstances are not unique. Most healthcare professionals across the nation are experiencing the same dilemma. This is unacceptable, and I promise that at PASNAP we will never stop fighting for what we need. This week we accomplished much, a great deal, and I am very proud of the work that we did together at PASNAP to make it happen. On Wednesday, we organized a statewide PASNAP Day of Action to raise public awareness and to pressure our hospitals and our government to take the necessary steps to ensure the health and safety of the frontline caregivers. In Philadelphia, we held demonstrations at Jeans Hospital, Einstein Hospital, and Temple University Hospital, where over 100 nurses and allied professionals stood in solidarity. In Delaware County, we gathered outside of Crozier-Chester Medical Center, and Delaware County Memorial Hospital also did the same. In Montgomery County, we raised concerns at Pottstown Hospital, and in Bucks County, nurses stood outside of Lower Bucks Hospital and made their voices heard. Our action was not limited to southeastern PA. Nurses in Scranton also demonstrated in front of Geisinger Hospital and brought awareness to the struggles we are all facing. Our goal was to raise awareness of what is happening in our hospitals, to inform the public, our hospital officials, and our government agencies. Our efforts resulted in a resounding success. Multiple newspaper and television news stories covering our Day of Action appeared across our state. For the locals within Philadelphia, as a result of covering our Day of Action, Fox 29 news reporter asked the City Commissioner of Health and Mayor Kenny during a live press conference about the lack of PPE for our hospitals in Philadelphia, where is the PPE? This happened because of all the great work that was done and that we will continue to do. 35 elected officials sent out messages on our social media to declare their solidarity with our fight to get proper PPE protection and to have the safe testing and quarantine procedures that we so desperately need. After our event, Congressman Boyle and his staff donated PPE to 3 of our locals in Philadelphia. His continued support of healthcare professionals is greatly appreciated. This would have not been possible without the nurses and allied professionals standing up for what we desperately need. While we've accomplished a lot, there's still more to do. PASNAP will continue to advocate with the PA Department of Health, with the Governor's Office, and with other elected officials. Basically, any and all agencies and politicians that can be helpful during this crisis to convey how serious The issues are on the ground for us as healthcare professionals. We will be launching campaigns in every hospital for the fight to the right to being tested upon request, and for hospital administration to make us aware whenever we are exposed to COVID-19, whether it be our colleague or a patient, we need to know. In conclusion, PASNAP will not rest until everyone has a safe working environment during the crisis and beyond. Healthcare professionals are not expendable and should not be treated as such. So stay safe, stay strong, and thank you.